So you have the orientation of the probe. I think you hear me. So you have two orientation. At the beginning, when you are a beginner, it's really important to have the bat sign. The bat sign is on the left. You can see on the right and on the left black shadows, and there is the shadows deeper than the ribs. And on the middle, you have the pleural line, which is a hyperechoic line. On the other side, on the right side of the image, you have the oblique or the transverse position. You can see much better the pleural line, and you can see the lung. But it's not it's really good to have to see the lung, but not to have the score we just talk about. So we think that it's better at the beginning to do with the longitudinal probe, longitudinal position. So the most important thing is the pleural line. You see the black arrows. They showed the hyperechoic line, which is curved, and on the right and on the left, you have the white arrow who show you the hyperechoic line, or also with the curve. In this image, you can also see the pleural line. It's an image, so it's not moving, but you can imagine that the pleural line is moving when you have a normal lung, and you have the reflection of the pleural line many times. Here you have 3 A lines. We will see it again on this movie. You can see on the left here and on the right here the hyperechoic line with for the ribs, and then you have the black shadow deeper than the ribs. On the middle of the screen, you have the small line here, which is the pleural line, and you can see that it's moving here. You see it. Careful to really see the good hyperechoic line. It's not this one. It's a muscle interstitial. It's not the pleural line. You can see it's moving there, and you can see the reflection of the pleural line here and here and here. This one are the A lines. Okay, it's a reflection of the pleural line. The B lines now. That's really important to see that here we just talk about the most important signs you will see in the COVID-19. Really, it's not all the imaging you will see with the lung ultrasound. You can see lots and lots of things. We just talk about the COVID-19. So in the COVID-19, you have most of time an interstitial pneumonia sign. So the sign with the ultrasound is the B line. So you have on the left only 1 B line, and on the right you can see 3 B lines with the sign from the interstitial syndrome. If you have only 1 line, it's not an interstitial syndrome. It's nothing. It's not a pathologic sign. So if you have more than 3 B lines, it's you can begin to talk about the interstitial syndrome. And if you have more than 6 B lines, you can talk about a severe interstitial syndrome. Careful because there is some lines who are not the B lines like that, but they are the Z lines. What is the difference between the A, the B, and the Z lines? On the left, you have the B lines. B lines is artifact comet tails. It's the origin is at the pleural line. That's for the B lines and for the Z line. But the difference is for the B line, it's like a laser ray. It's thin, it's hyperechoic, it's long till the end of the screen. That's really important. It's moving with the pleural side. And there is no more A lines when you have the B line. On the other side, when you speak about the Z line, it's not well designed, it's non-hyperechoic, it's short, it's no more than 3 or 4 centimeters, but not to the end of the screen. It's not moving, not synchronized with the pleural sign. And you can see the A lines. The Z lines are really an artifact. There is no correlation with a pathologic sign.